Right now, we have a special guest joining us in studio here this morning, Dr. Casey Johnston, Prairie Lakes Orthopedics. Good morning, sir. How are you doing today?
Good morning. I'm doing great today. Thanks.
Good to have you here with us, and always fun having you in because we always learn a lot. And I said, what kind of topic you want to talk about today? And you mentioned they have a shoulder campaign going on this month. So shoulder, very important part of the human body, and we kind of want to talk about that a little bit. So give us a little info on the shoulder.
Sure. Shoulder problems are very common in our practice. So we see them all the time. And the age ranges from young athletes to middle age with just shoulder pain, and then going on to people that develop shoulder arthritis, which is actually becoming a much more common thing in our practice and in orthopedics in general.
Sure.
Yeah, we see the whole gambit of it and treat every age and every problem.
What are some of the main causes for the shoulder problems?
I think the vast majority of the ones that I see are typically inflammatory, meaning people get what we call insidious onset, so no apparent reason why their shoulder starts hurting and then develops over of time. And then typically speaking, that's a easy thing to treat. Some physical therapy, anti-inflammatories, maybe a steroid. But then the opposite of that is the injuries, and certainly around here, especially in the wintertime. And sure enough, early in the spring, people are out fishing and they climb down on the ripraps, and pretty consistently every year I see one or two people that end up with rotator cuff tears from trying to go fishing. We see all kinds of stuff like that.
I was telling you over the wintertime, probably about 5 years ago, I was out shoveling, didn't have the proper footwear, slipped, landed on my shoulder, and I can't tell you, that was probably the worst pain I've ever felt. And of course, I didn't do anything about it because I was a tough guy at the time, but it was really just, I'm sure you see a lot of issues with that, with people out shoveling and stuff like that.
Yeah, definitely see that all the time, falling on the ice or shoveling and hit something hard. And I see that scenario all winter long. And the good news is that most of them don't end up being traumatic tears or anything like that, but just that mechanism can create such a painful response that people have a really hard time using their shoulders. I see a lot of those in the clinic.
Do you find a lot of people might have a shoulder injury or an issue going on, they don't do anything about it, and they let it go too long where it becomes an issue?
Yeah, rotator cuff tears in particular, if people have one that they neglect, or some of them aren't that symptomatic, so they get by. But the worst case scenario is a younger person in their 40s or 50s that's had a rotator cuff tear for a couple of years. And we actually run into scenarios where we can't fix them anymore because they retract and they become very challenging. So that's a really tough spot to be in. Yeah, I generally encourage people, if they're having symptoms for longer than they think, they should definitely come in and have it checked out.
I've heard a lot about shoulder replacements here recently, a lot of people getting them done. And I know there's maybe a misleading thing out there that it can be difficult surgery, maybe to some of the different ones, or the recovery, but you say that's really not the case.
Yeah, shoulder replacement and shoulder tendon surgery are two totally different things. Tendon or rotator cuff surgery does have an extensive recovery and can be fairly prolonged, but shoulder replacement's actually a pretty quick recovery. From a pain relief standpoint, I have people that come back to clinic at 2 weeks and say, my shoulder doesn't hurt anymore at all.
Wow.
And we don't have to use the same sort of rehabilitative things and measures. And so people do get better quite a bit faster. And one of the other things that I do that probably expedites that a little bit is we do patient-specific shoulder replacement now, where I do a 3D CT scan, which I input into a computer plan.
Sure.
Which means I can orient the components how I think they'll fit that patient the best. It even goes so far as the technology exists that I can 3D print like a socket part that if somebody has a funny anatomy, then we can actually specifically accommodate that by 3D printing of the implants that we use.
How long have you been doing medicine? How many years would you say?
I've been in practice here for 15 years. Okay. Started out with 6 years of training before that, so.
I'm sure you've seen things change greatly due to the technology, kind of like you were just talking.
Yeah, in fact, one of the operations we do is called a reverse shoulder replacement, which is a little bit different operation than a standard shoulder for various reasons. But when I was in training in Omaha, I actually did the very first one in Omaha with the guy that I trained with. And now in orthopedics, that operation has superseded the standard shoulder by about 30 or 40%. So we do 60, 40, 70, 30 reverse shoulders versus standard shoulders. And
explain that. What's reverse shoulder mean?
So for people that have a deficient rotator cuff, you rely on your rotator cuff or the muscles and tendons around your shoulder to make your shoulder function right. And you can't put a standard shoulder in that person because it will fail quickly. So a reverse shoulder actually reverses the ball and socket, which is for biomechanical reasons, takes advantage of other muscles around your shoulder. It's a little hard to explain unless you see pictures of it,
Sure.
but it does. When I tell people I'm going to put their shoulder in backwards, they always look at me a little funny. But when I show them the pictures and describe that now we're going to retension your shoulder differently to make it function better, they understand it. But yeah, that's a very common operation that we do now.
One more question for you. After somebody has had total replacement or reverse shoulder surgery, do you find their movement goes back fully to what it was?
For the most part, yes. Yeah. The thing that happens with arthritis is your shoulder starts to contract, and I always say they're getting a bad bearing, which everybody in our rural area understands what a bad bearing is. We've all had one. But so your shoulder doesn't move efficiently. So we remove that bad bearing, exchange it for metal and plastic and retention things. So the vast majority of people do get, number one, pain relief, number two, better function, better strength, and better quality of life.
Prairie Lakes Orthopedics, you guys do a great job, and we're talking about shoulders here today. If somebody out there is having some shoulder issues, what's the first step they should do?
They can give us a call at 882-2630, which is our office number, or check us out on the Prairie Lakes website on the orthopedics page.
All right, sounds good. No reason to be in pain, right? Get it fixed.
No, definitely. We generally have a solution for all the things that come in.
Sounds good. Nice seeing you again. We'll talk with you again soon.
Yeah, same to you. Thanks for having me.
We appreciate it. Dr. Casey Johnston, Prairie Lakes Orthopedics.